Hello, everybody. Thank you for joining our family meeting. As I mentioned 2 weeks ago when we met, that we would probably be having another meeting soon. And sure enough, there are more changes. I would like to introduce our interpreter for today. This is Sarah. And Sarah is working with us in activation. She is replacing Jessica Dyke, who is replacing Jessica Oikel. So welcome. So I'm going to be reading to you from Resuming Visits During Pandemic Restrictions. I will be sending this out to you later today. This comes into this new policy, this revised policy, comes into, the revisions come into play tomorrow, June the 9th. So this is based on Directive Number 3, which was dated June the 4th and is effective June the 9th. The Minister's Directive, the COVID-19 long-term care home surveillance testing and access to homes is also effective. There's been changes on June the 9th. So just a reminder that all visitors must agree to abide by the health and safety practices contained in this policy as a condition of entry into the home. Public health measures must be practiced at all times. All visitors must be actively screened for symptoms and exposure for COVID-19 before they are allowed to enter the home. Okay, so the changes. As you all know, the provincial stay-at-home order expired on June the 2nd, and based on current trends and key health indicators, including the provincial vaccination rate, the government announced on June the 7th that it will enter step 1 of the roadmap on July the 11th, which is Friday. A simple, easy to understand summary of restrictions can be found on the province's Reopening Ontario webpage, which provides details with public health measures in place before the province enters step 1 of the roadmap to reopen. As per the Residents' Bill of Rights, BRHD fully respects and promotes a resident's right to receive visitors. BRHD will provide for residents to see visitors in accordance with the Directive Number 3, the Ministry of Long-Term Care Policy and Guidance, in accordance with any orders from the Simcoe-Muskoka District Health Unit, and will not place,
just the last
Simcoe-Muskoka District Health Unit, SMDHU. And we will not place unreasonable restrictions on the resident's ability to do so, to have a visit. Where BRHD believes there is a valid health and safety reason for imposing additional restrictions on general visitors beyond what is set out in Directive 3, we will consult with the Simcoe-Muskoka District Health Unit. So information for all visitors. Visitors must wear a medical mask when indoors, and we do provide those. For outdoor visits, visitors must wear a medical mask, which we will provide to you. And it really, the kind of mask you wear will depend on the type of visitor and proximity to the resident, which we'll get into. Visitors will be directed by our staff, by the signage, and you will wear the appropriate PPE, depending on several factors, which may include one or more of the following: where the visit will occur, whether the visitor and or the resident are fully immunized, whether the visitor will be in direct contact with the resident, the risk of infection transmission in the home. Example would be, we would be in outbreak status and location of outbreak as applicable, and as directed by the Chief Medical Officer of Health for Simcoe-Muskoka District Health Unit. Effective June the 9th, BRHD will not restrict physical touch, for example, holding hands between caregivers and general visitors who are fully immunized and residents who are fully immunized, provided the appropriate Infection control measures are happening. Example, wearing masks, hand hygiene are in place. Brief hugs are now permitted regardless of immunization status. So basically they're saying to have close contact with the resident, you have to be fully immunized. The resident has to be fully immunized. But on the other hand, you have to stay 6 feet away from the resident, but you can give them a brief hug. We will not be timing these hugs, but just to know that you don't have to be vaccinated to give them a hug. So your visit might be supervised. And if it is supervised, it's only so that we can support the residents' health and safety during the visit. It would be monitoring the resident. However, the privacy and the ability for you to have a discussion will be respected, and we will make sure that the individual is far enough away to give you that privacy that you need. Staff will ensure that the residents have sunscreen on during the visit if where tolerated, and will encourage the resident to wear a hat and sunglasses. And so again, where there's a need for a supervised visit, the supervision will be implemented in a manner that respects the resident's right to communicate in confidence, receive the visitor of their choice, and consult in private with any person without interference. That's one of the resident rights, so we need to make sure that we're following that. Pets are now allowed to be brought in outdoors only. They must be leashed and under full control by the person bringing in the pet. And we also ask that you pick up and properly dispose of any excrement from the pet. We do strive to meet the laws such as Accessibility for Ontarians with Disability Act. So if you're coming and you need some kind of accommodation, please let us know when you're booking your appointment. Active screening. All visitors who are required to be actively screened, and they must pass the screening. If a visitor fails the screening, they will not be allowed to enter the home or visit outdoors, and they should go immediately to self-isolate, and they're encouraged to get a COVID-19 PCR test. We also have now received some information, and so that will be handed out to the individual if they do fail the testing. For indoor visits, general visitors must also demonstrate that they have had a negative antigen test on the day of the visit, or demonstrate proof that they received a negative antigen test from an antigen test taken on the previous day. They are not permitted to proceed to the resident until the result is confirmed. So if we do have, for some reason, a general visitor coming into the home, they, like the rest of us, would have to be antigen tested, wait for the negative outcome before they would be allowed in the building. So there are a number of questions that you will be asked when you're coming to be an outdoor visitor as part of the screening. These questions change from time to time based on what the Ministry of Long-Term Care sends to us. And if you are coming to visit with any kind of essential caregiver, general visitor, outdoor visitor, you are encouraged to read this document because it will help you understand where we're coming from. I just want to talk a little bit about physical distancing. As I mentioned, as of June 9th, brief hugs are permitted between all residents and visitors, regardless of your immunization status. As of June 9th, close physical contact is permitted where both the resident and the general visitor are both fully immunized. So that basically means that if you're fully immunized and the resident is fully immunized, you can sit and hold hands with the individual. For the purposes of compassionate or palliative visit, we don't worry about physical distancing. So I hope this doesn't get a little too confusing. So where the total immunization coverage rate within the home is set out by the Ministry of Long-Term Care, and there's a guidance document. So right now, for example, 85% of residents fully immunized and 70% of staff fully immunized. If we were to meet those requirements, we could allow the residents to sit together for meals, and they could join together for social gatherings. And I won't get into the family member because that's talked about later. Fully immunized caregivers in the home who have passed screening may join in the communal dining and the indoor activities in the home, regardless of the vaccine coverage threshold. So if you're fully immunized and you want to, be with mom in an activity, you can do that. We will not be able to. We won't be able to allow the communal dining or the activities if we don't meet the necessary threshold. So BRHD's immunization coverage rate has fluctuated around the required minimum. And as of June 8th, the current resident immunization rate exceeds the minimum requirement, and the current staff immunization is just 1% shy of meeting the minimum requirement, which is 70%. So I think a couple of weeks ago when I talked to you, I said the staff rate was 75, but since that time, we've had some people leave, and then we've hired new people who haven't had all of their immunization or aren't being immunized. So that's why it will fluctuate depending on new residents coming in, whether they've been immunized, new staff coming, that kind of thing. So BRHD will recalculate the immunization coverage rate weekly, and the screener and the registered nursing staff will be aware of the current immunization rate, and then we can inform visitors, and then we will act accordingly in terms of communal dining and activities. Visitor responsibilities, please cooperate with the active screening. The rest you can read through. There are different types of visitors. Basically, there's essential visitors and general visitors. And then there are subtypes under those particular two groups. So essential visitors could be students, volunteers, government inspectors, that kind of thing, and they would be an essential visitor. So essential visitors are required to wear eye protection when they're unable to maintain 2 meters of physical distancing. Effective in the 9th, fully immunized essential caregivers are not required to wear eye protection when indoors. Eye protection is not required by any visitor for outdoors. And the same would go for support workers. So as the number of visitors hasn't changed, a maximum of 2 caregivers per resident may visit outside the home at one time, and the 2 essential caregivers can join the group. And that is the courtyard in the center, and we have 3 visitation stations that you could be assigned to. So we've also allowed for essential caregivers to take their loved one outdoors. We have 2 other courtyards, one at Care Center 1 and one at Care Center 2, and you are welcome to take them out there. Please don't take them out in the middle one, as we want to keep that available for outdoor visits. Caregivers need to be antigen tested for indoor visits. I already said that. Effective 9/21, eye protection must be worn inside unless the caregiver is fully immunized. We've already already talked about that. Other essential visitors would be palliative or compassionate visitor. They need to be screened. If they do not pass screening, they would need to go home and get tested. And if they were not in agreement with that, they would have to get in touch with Simcoe Muskoka District Health Unit and discuss it with them, and we would go on the advice of the health unit. Right now, we're permitting 2 palliative visitors at one time, and we reserve the right to determine the maximum number of palliative visitors. For example, to have 20 people coming in and out of the building, but 2 at a time. Reasonable. We'll always try to be reasonable. Emergency responders do not have to be scanned or tested, obviously. I'll repeat myself. So in terms of the outdoor visits, we have the discretion to limit the frequency of visits, but we'll make every effort to provide at least 2 visits per resident per week. BRHD has the discretion to limit the length of the visit. However, we will aim for you to have at least 60 minutes, and we would encourage you when you call to make your appointment to identify how long your visit will be. So they've now made indoor visits with exception only. So recognizing that outdoor visits may not be possible for all residents. Effective June the 9th, a resident with mobility limitations or health conditions that are not related to weather may have 1 general visitor come indoors with the essential caregiver. So this is only for someone who is completely bedridden, is unable, in our staff's estimation, to be able to go outside and have a safe and healthy visit. Then,
so the can you just repeat that last
sure.
paragraph? Sorry.
So that's okay. So a resident who is basically bedbound and is not able to get up and be able to go outside to have a visit is allowed to have 1 indoor visitor along with their essential caregiver at one time. Okay. So BRHD staff who understand the resident's health status and mobility limitations will determine if an outdoor visit for that resident is extremely challenging or not possible. This may include assessing the resident's level of physical functioning, type and level of assistance that is required to support the resident in participating in an outdoor visit, including disease diagnosis, health condition, and their overall well-being. The general visitor may not visit indoors for the sole reason of inclement weather. So that is not part of what the ministry is allowing. If a portion of the home is in outbreak, the residents who are unable to participate in an outdoor visit and are not affected by the outbreak may continue to have 1 general visitor indoor with their caregiver. General visitors will have to show proof of being fully immunized if the general visitor wants to have close physical contact with residents.
Can you just start that last paragraph?
Okay, that's okay. So we're talking about general visitors. So this is for an outdoor visit. You need to show proof of being immunized if you plan to have close physical contact with the resident, other than a brief hug. So if you want to sit and hold hands and sit close to the resident, you need to be fully immunized and you need to show us proof of that. You just need to show it once and then we'll have it on record. You're still allowed the 1 hug. I don't know if it's 1 hug. You're allowed a brief hug even if you're not immunized. So if you come and you say, I haven't received my 2nd shot, you still can hug your loved one. You just can't sit close and hold their hand at this time. If it's an indoor visitor, we will be screening you indoors at our usual screening area. If it's an outdoor visit, you will be screened at the gate at the back before coming into the courtyard. And again, it just talks about physical distancing, it talks about brief hugs, and where both the resident and the visitor are fully immunized, close physical contact. General visitors must wear a mask, and we will provide you with a medical mask. If you're going to be in close contact with the resident, we want you to wear the most protection, which is the medical masks that we have. General visitors, if you're outdoors, you do not need to wear eye protection. However, unless you're fully immunized, if you come indoors to do a visit because you can't visit outdoors, you're not fully vaccinated, you will need to wear a face mask, which we will provide. So scheduling of visits hasn't changed. Please contact Amy. If Amy's not available, please contact Jennifer Pilon. And then at the end of this policy, there's an algorithm of how the visitor testing during non-outbreak is done. So you can go through and say, yes, no, and where do I go and how would that work for me? It's also testing for caregivers and testing for general visitors is in this as well. I did want to sort of briefly touch on non-adherence by visitors. So we've had some issues over the past week with some family members being very verbally abusive to our staff. I want to remind you that they do not make up the rules. They are following our direction. And especially the screeners, they're just students. So please, I would ask that you respect that. And if you do have a concern, I know it's been long and hard, please contact me directly. We really do try to accommodate everybody the best way that we can. But I must ask that you respect our staff. That is, we have rules about non-adherence, and it's the last thing I want to do is stop somebody from seeing their family member or punishing a resident because their family member does not know how to behave after they have been in this home for 15, 16 months without being able to really have a good visit. So please keep that in mind and feel free to contact me. We can discuss the issues. And I think, yeah, just to remind you that the screeners will need to have a list of everybody that's fully immunized. We have some names. We may not have everybody, especially if it's a general visitor. And I think that covers it. And of course, we've got all kinds of appendices that you can read up on. So I will be we'll be emailing this to you today after our meeting so that you have it and starting tomorrow, these new changes will come into effect. So I'm just going to I'm not going to cover admission and readmission because everybody listening has already had their family admitted to the home. I'm going to talk about resident absences and what comes into place tomorrow, June the 9th. So based on the current COVID-19 trends, the government has announced step 1 as of June 11th. And so part of this fits in with it. We go to absences. Okay, so BRHD will now permit residents to go on absences as outlined in this policy, which I will also send you. It's important that the residents be able to engage in physical activity and take part in activities that bring them joy, comfort, and dignity while remaining safe. Residents who are not under isolation requirements or symptomatic can leave the home, take a walk in the immediate area, to support their overall physical and mental well-being. For all types of absences, BRHD will provide medical masks to the resident as tolerated and will remind the resident to follow health measures. All residents on an absence, regardless of the type or duration of the absence, must be actively screened for symptoms and exposure history before they are allowed to enter the home. We will not restrict or deny any absences for medical or palliative or compassionate reasons at any time. That also includes residents that are in isolation, droplet and contact precautions. And if we have those kind of situations, we would be in touch with the public health to get their guidance. So we're going to gradually resume social absences and temporary absences. Residents who are in isolation or droplet precaution or reside in an area that has an outbreak will not be able to participate in social or temporary absences for obvious reasons. Okay, so the medical absences have not changed. A medical absence must, this is in the Act, so this is not new. Medical absences must not exceed 30 days, and psychiatric absences must not exceed 60 days. So we have what's called compassionate and palliative absences, single day, which is less than 24 hours. You do not require testing or self-isolation upon return. Overnight absences, you will be required to have, the resident will be required to have a test and will be in isolation until we receive the results. So short-term day absences, which are less than 24 hours in duration, testing or self-isolation of residents is not required. Residents do not need to seek approval from the home to go out on a short-term absence, but we would ask that you let us know if you're taking a loved one out so we know where they are. So there's two types of short-term day absences. There's essential day absences and the social day absences. So the essential day absences include absences for reasons of groceries and pharmacies, which I don't think our residents would need, or outdoor physical activity that are permitted when a stay-at-home order is in effect. All individuals, regardless of their immunization status, can participate in essential absences unless the resident is in isolation. The next type of absence is social day absences. These include absences for any reason that's not listed under the aforementioned absences. So, but this does not include an overnight stay. As of June 9th, residents who are fully immunized can leave the home for social absences. Whereas essential day absences, which I mentioned previously, your immunization status does not matter. Okay, temporary absences. These include absences involving 2 or more days and 1 or more nights for non-medical reasons. Casual absences must not exceed 48 hours. Vacation absences must.
Just list that off again, starting with the temporary absence.
Okay, temporary absences include absences involving 2 or more days and 1 or more nights for non-medical reasons. A casual absence must not exceed 48 hours. Vacation absences must not exceed 21 days. This is all as per the Act.
The last one.
Vacation absences must not exceed 21 days. As of June 9th, residents who are fully immunized may leave the home for temporary absences with approval from the home. So to go out for the day, you don't need approval. If you're going overnight, then you need to get approval from the home. And the approval does not need to be in writing. It can be just verbal. And I can't think of a time where, unless we were in outbreak, where we would say no. Residents who leave the home for an overnight absence are required to have a lab-based PCR COVID test done upon their return and remain in isolation while their test is pending. So just as a note, on the back of the appendices that are attached to this particular policy, appendices B is actually right out of the Long-Term Care Homes Act in regards to absence requirements. So just to note that the ministry has not mandated immunization for residents, staff, or caregivers, and aims to provide all individuals, regardless of their immunization status, the ability to socialize with loved ones. The Ministry of Long-Term Care is taking a cautious approach to modifying restrictions in homes based on assessment and risk factors, including immunization status.
Sorry, I'm calling behind here.
Okay.
Ministry has not mandated immunization.
Okay.
Sorry.
I'm just going back to where. Okay, so the ministry has not mandated immunizations for any resident, staff, or caregiver.
Okay.
And aims to provide all individuals, regardless of immunization status, the ability to socialize with loved ones.
Okay.
Ministry of Long-Term Care is taking a cautious approach to modifying restrictions in homes based on an assessment of risk factors, including immunization status, as the pandemic continues to evolve, public health conditions improve. Ministry anticipates making additional changes to further ease restrictions, including for both vaccinated and non-vaccinated residents. So I will send that out to you, and I'm sure, rather than me telling you, it'll be easier to understand as you've read it through. If you have any questions or don't understand anything, please let us know. We will be informing residents of these changes as well, so they know that they can expect visits with you. The screeners and everyone, all the staff need to be educated as well. So I just have one more thing that I wanted to bring up. Some of the families are bringing in sort of bulk supplies for their family member, and we're running out of places to put things. So I would just ask that you don't send stuff in bulk because the rooms are too small and they just don't have room to store everything. I know that you want them to know that you love them, so you're sending them lovely packages, which is great, but just be aware that we're running out of room. So, and I don't really have anything else to share with you at this time. See, there's a question, a comment. Okay. I am so sorry to hear that any of your staff have experienced any disrespect. We are so very thankful for each and every one of you. Thank you very much, and I will certainly pass that along to the staff. It's hard for families. They come, they're expecting to be able to see their loved one, and then they're told, it's too hot or whatever, you'll have to go to a window visit. And it's hard on the resident and it's hard on the family. And it's hard on the staff too, because the staff, it's not something they want to do. So thank you for that comment. Okay, so just so you know, crying because one is denied access is not disrespect. Recognized, absolutely. But that's not what happened. And as you know, there's a bit of a delay, so we'll give you another minute or so. And if you have any more questions or comments, you're welcome. Okay. Well, if there's nothing more, again, thank you. Stay safe. We're looking forward to more changes, even though it means a lot more work, but we just want to see everybody happy. We want to see our residents reunited with their families. So until that time, we'll continue to do our best, and we thank you for your support. And stay safe. Thank you.